Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Hepatitis, a term that might sound unfamiliar to many, yet it represents a significant health challenge worldwide. It's inflammation of the liver, a vital organ responsible for filtering toxins, digesting food, and storing energy. The liver plays a crucial role in maintaining overall health and well-being. Viral infections, particularly hepatitis A and B, are common culprits. These viruses can silently attack the liver, leading to serious health issues if left untreated. Hepatitis A, linked to contaminated food and water, typically causes acute illness. Symptoms can include fatigue, nausea, and jaundice, but many recover fully with proper care. Hepatitis B, spread through infected bodily fluids, can lead to chronic infections and severe liver damage. This form of hepatitis can be particularly dangerous, often requiring long-term medical management. Many infected individuals experience mild or no symptoms, unknowingly spreading the virus. This silent transmission makes it a public health concern. Join me as we explore hepatitis A and B, their causes, symptoms, diagnosis, treatment, and prevention. Understanding these aspects is key to combating this silent epidemic and protecting our health. Understanding how hepatitis A and B spread is crucial for prevention. These infections can have serious health consequences, so knowing the transmission routes helps in taking preventive measures. Hepatitis A spreads through the fecal-oral route, often via contaminated food or water. This means that the virus is ingested through the mouth, usually from food or water that has been contaminated with fecal matter. Imagine someone with hepatitis A preparing food without washing their hands properly. This can easily lead to the virus being transferred to the food and then to anyone who eats it. Common culprits include contaminated water, raw shellfish, and improperly washed produce. These sources can harbor the virus and cause outbreaks if not handled correctly. Hepatitis B spreads through infected bodily fluids like blood and semen. This virus is more insidious because it can be transmitted through various means, making it harder to control. Transmission occurs through sharing needles, unprotected sex, and other activities where bodily fluids are exchanged. It can also be passed from mother to child during childbirth, which is why screening and preventive measures are so important for pregnant women. Good hygiene, safe sex, and avoiding needle sharing can significantly reduce the risk. Simple actions like washing hands thoroughly, using protection during sex, and ensuring needles are not shared can make a big difference in preventing these infections. Recognizing symptoms of hepatitis A and B is crucial for timely medical care. Early detection can significantly improve outcomes and prevent complications. Hepatitis A often presents flu-like symptoms such as fever, chills, and general malaise. Additionally, jaundice, which is the yellowing of the skin and eyes, loss of appetite, and a general feeling of unwellness are common. Other symptoms include abdominal pain, nausea, and fatigue, which can be quite debilitating. Hepatitis B can be asymptomatic for years, making it a silent threat. However, when symptoms do appear, they may include jaundice, fatigue, muscle pain, abdominal pain, and dark urine, which can be alarming. These symptoms can indicate other conditions as well, so it is essential to consult a healthcare professional if you experience them. Early diagnosis and treatment are key to managing these infections effectively and preventing long-term liver damage. Don't ignore persistent symptoms. Seek medical advice promptly to ensure proper care. Awareness and prompt action can prevent further transmission and protect your health and the health of others around you. Diagnosing hepatitis A and B involves medical history and blood tests. Doctors will ask about recent travel, food and water consumption, and risk factors like unprotected sex or needle sharing. Blood tests confirm the diagnosis, liver function tests, hepatitis A antibody test, and hepatitis B surface antigen test. Timely diagnosis allows for appropriate treatment and prevents virus spread. Early intervention is crucial, especially for chronic hepatitis B. Accurate diagnosis is the first step to effective management. Treatment for hepatitis A and B differs significantly. Hepatitis A usually resolves on its own. Treatment focuses on rest, hydration, and a healthy diet. Avoid alcohol to reduce liver stress. Most recover fully within weeks, but severe cases may require hospitalization. Hepatitis B can become chronic, needing long-term antiviral medications to suppress the virus and reduce liver damage. Regular monitoring and follow-up with a doctor are essential for managing chronic hepatitis B. Effective management prevents complications like cirrhosis and liver cancer. Prevention is better than cure for hepatitis A and B. Hepatitis A. Vaccination and good hygiene are key. Vaccinate children, travelers, and those with certain medical conditions. Wash hands thoroughly and consume safe food and water. Hepatitis B. Vaccination and safe practices are crucial. Vaccinate children and at-risk adults. Practice safe sex and avoid sharing needles. Embrace these measures to protect yourself and your community from hepatitis A and B. UMCC, your ultimate medical consultant connectors.